with our, focus and priority as 10 to 19 on ensuring that we look at adolescents, young people in India, what is happening through this COVID time, but also recognizing that their vulnerabilities have existed even before. It's only been exacerbated with this situation. And today's conversation, we're hoping, is a bit of a deep dive into a slightly practical lens of thinking about how we as a group of practitioners, all the way from funders to not-for-profits to academicians and technical experts, grantee partners and civil society players, how can we all come together to ensure that we speak in a bit of a collective voice, that we are aligned in trying to advocate, in advocating for and putting all our strength behind ensuring that we bring the issues of vulnerable communities, especially adolescents, to the fore. We have quite interesting packed session. We have panelists for this webinar. There is Asif Sheikh, who's the founder of Jana Haas, Anand Sinha, who's the country advisor of the David and Lucille Packard Foundation, India. Anita Raj, director, UC San Diego Center on Gender Equity. And there's Shireen Vakil, head policy and advocacy at the Tata Trusts. So they're all there. You can see them. Anyone feels like waving, please do. We're going to start with a little bit of an introduction to the kind of conversation we hope to have today. Just to be disciplined and just to ensure that, in this new medium of online conversation, we keep on track. We will have to follow a few disciplines. So if I can just, thank you. If I could just repeat a few house rules. This is a session that is being recorded. It is live on YouTube as well. So you can invite other people to watch it on YouTube in case they can't log in right now. We can share the YouTube link once it's recorded. We hope and always strive for these discussions to be constructive. It's less about any personal or particular specific points of view. I think Dasra and 10 to 19 believe that we must respect all opinions, all discussions, all perspectives. But of course, there is always there's always the beauty in being able to share your thoughts and your perspectives. So there is an ongoing chat, as you can see in all the Zoom rooms. So please list your questions and please talk about what your reactions to what we're talking about are. We've listed our email address right now on the screen. We're happy to go into a deeper dive discussion with any of you, organizations, individuals, through our 10 to 19 community at dasra.org, and share anything you would like to hear or follow up on post this discussion. We will be very particular about muting everybody's audio and video just to ensure that we focus on the ongoing conversation. If you have any issues with connectivity, please log off and log back in. Okay, so now to begin with, we just wanted to it's always helpful for us when we've done these webinars. I think this is our 5th or 6th webinar since March. So it's been a good run, but what's always been interesting is to do this kind of a quick poll to understand all of you participants who are in the room, where do you all come from, what kind of organizations. So if I could please request the Dasra team to display the first poll. There will be like a survey type of poll. You have to select and then scroll down to reach the last questions also. We're going to wait for about 5-6 minutes till everybody polls in. So please look, I hope it's all on your screens. Okay, we need more people to take the poll. We're getting people responding. Come on, everyone, exercise your rights. Okay, we've hit 70% of people responding. Should we show the results? Yeah, let's share the results. So as you can see from the number of people who responded, which was about 70% responses, we see that organizations who are right now in our participation room, for about 26% of you, adolescents are the primary audience. For 35%, you all are not really looking at young people and adolescents as your key stakeholder or community stakeholder in the programming that you do. And for 15%, it's not relevant. In terms of what you have seen as your personal experience of the funding and the direction of funding and program efforts with COVID coming in, you see that food security and rations, 42% is where a lot of the support has gone. Emergency health service obviously is where a large part of it has gone. Mental health, some. Digital inclusion, some. And very little to sexual and reproductive health and rights. That's interesting. And if we go to the last question that you all answered, which is what are the key issues affecting adolescents and young people in COVID? We see that education has come up as the primary one. Mental health is being spoken about, of course, 32%. And violence, as we all know, has been quite exacerbated through this time. Child and early marriage, 6%. And again, access to reproductive health and rights services and products is 9%. Okay, thank you very much. I hope this was interesting. And we're going to do one more poll. So can I ask the Dasra team to share the second poll as well, please? Okay, are we ready to share? It's just being populated on my screen. Give me 1 minute, I think. Okay, we are getting responses, and just a few more, and then we'll play it back. Okay, so let's share back. Can we share the poll back? All right. So we have, as we can see from the responses, we have a large part today participants who are from civil society organizations, some from funding organizations, and then of course technical support. But a large part is others. I wonder what others is. Um, what is your primary focus in the adolescent space? We see that education, there is a huge participation in this room, gender and empowerment, sexually reproductive health and rights, um, and child protection at 18%. An overwhelming 80% of you all are working on COVID-19 relief. That's interesting. Has your funding pivoted towards relief efforts? Yes, say 68%. And as a correction, I think the first question and answer from the last poll was about, it was about the 35% of the funding not being diverted. So I clarify and I correct myself. And coming to the fifth question here, it looks like organizations are of medium and small size who are participating here. So it's good to know ourselves as an audience and where we're coming from. Okay, thank you very much. Thanks so much. Okay, so let's stop showing the results and move on. I know you all have been patient through this, but I hope you all found this part useful. If I can just quickly take a minute myself, sorry, I know I've been speaking a lot, but just give me about 2 to 4 more minutes right now, and just to set up the conversation. If we can move on to the next slide, very quickly, what we wanted to showcase is, as Dasra, we speak to a lot of funders, foundations, HNIs, givers, as well as NGOs who work in the sector. If we can, yeah. And, when we were doing a bit of an analysis, with respect to the how the changing narrative of poverty is with COVID onset. Last year in the India Philanthropy Report, when we launched it, we had spoken about the urgent need to work in a collective manner to try and have efforts to alleviate poverty. And by poverty, a lot of the SDGs is what we meant in simple language. And we said that if we don't do that, then there will be 330 million people across India who will be pushed into further poverty. So it's not what we were arguing was, it's not that just because the economy would grow, everyone across different income and social development levels would grow. There had to be concerted level from civil society, from funder, from philanthropy, to get the very vulnerable also back on track. But now with COVID, for the first time in 20 years, we're going to see globally a rate of no improvement to extreme poverty, but in fact, a decrease or an increase, sorry, in poverty. That's the first time it's happening in 20 years historically. And so the only thing that we're trying to say with this seemingly complicated slide is what we all know is that there is an issue currently, but there is even more of a need for us to work all together in a coordinated fashion if we want to come out of this crisis. If we can go to the next slide, please. Again, in conversations, we have a few groups and conversations with foundations. We have a community of practice. We have the Dasra social impact, where we work with organizations on their capacity building. Issues around urban equities and the vulnerabilities that are faced in urban spaces, they have come up. We have, the need to work on a long-term level, changing systems and ensuring that while you look at government as the one-stop scale solution, it's also important to continue to build community-based assets and work through something called a community of practice in whichever version, which is again what I spoke about, collaborative effort. And lastly, what here is in blue called the resilience approach. Through COVID, what's really been an issue is the struggle that not-for-profits have had. We all know that we get grants year on year from foundations, from grantee partners. There are results we have to show very quickly. But what is going to now happen with everything being diverted towards COVID relief? What are we going to do in terms of the mission that we are working towards, that we have committed our communities, that we have committed to our communities, and how are we going to ensure that in this changing world of different, sometimes even lesser CSR funding, in terms of maybe sometimes pullbacks of original grants, how are we going to ensure that organizations survive to support and continue their commitments to the communities? If we can shift to the next slide, please. And as you see in terms of, the inequities, if you look at the bottom left side, out of the, there are 149 women and girls who are at this point, and this is, I can't corroborate this from scientific data sources. This is from newspaper articles, some conversations, and some, reports that we have read. But this is the large estimation of 149 million women and adolescent girls and 110 vulnerable and elderly, 110 vulnerable elderly and children. So we definitely see that vulnerable populations like our adolescents, like women, like girls, like the issue of gender are really at risk right now. And the last slide, if I can go to, is to say that if we now come to adolescents, and I'm not going to repeat it because all of you practitioners are here, but it's here just for us to, play back really, that there is an issue currently, sexual reproductive health and rights. If you saw, I think a month ago, it was Menstrual Health Day, and there was a huge upheaval from sanitary pads and menstrual products not being provided to young girls in communities, in villages, even in urban spaces. If you talk about violence, that has increased. If you talk about marriages, there has been a lot of, you hear a lot about Childline getting calls for early marriages as well as for young pregnancies as well. And so the idea for this conversation today is for us to really have a discussion on what our foundations, grantee partners, NGOs, and experts talking about how we can shift the focus back. And it's not an exclusive this or that. It's not an independent piece of work. When we do talk about the impact of COVID, when we do talk about the impact of health crisis, it does include our young people, adolescents, and the issue of gender and girls as well. So now if we can stop the presentation, let me move to Asif. Asif, thanks for joining this conversation. Asif, I know yesterday we were speaking about the fact that Jana Haas is very much doing amazing work on the issue of migrants, what's happening with them and their vulnerabilities as as they have been exaggerated in this situation. However, I know Jana Haas also works with adolescents. Can you tell us a little bit about, have you been able to continue your focus and programming for adolescents? What have been your challenges so far?
Yeah. So, am I audible?
Yes.
Okay. So, basically, first of all, like we try our best to provide all kind of support to the communities in this current COVID situation. But we realize as like some other issues, for example, like the migration issue, it got attention from the media, from the policymakers and the other stakeholders, but we were not able to explain the vulnerability of the adolescent population in our working area. So that's why we are struggling a lot for like the fundraising for support to the adolescents. uh, we are struggling for raising funds to continue our existing program, but also because lots of new interventions are required for COVID response, but we are not able to continue that kind of work also. So that's the one thing. But this one another issue is कि most of the like the government authorities or agencies, civil society organization, and the philanthropy also responding at the community level as far as COVID is concerned. But the problem is most of the time we are focusing on the like the groups, for example, like the poor people or migrant worker and some other like the groups or categories. But within that, basically the huge number or population is there of the adolescent, like the girls or boys, but these intervention are not able to serve effectively to this population. So that's a the second large issue. And the third issue about the policymakers or like the government, state government, or like the central authorities, because this group is not voting basically. So because they are not voter, most of the like the people or like the institutions not taking their issues very seriously, or they are not in the priority of the policies. So that's also affecting very badly for the work with the adolescents in this current like the complicated situation. As you mentioned, we are very intensively engaged with the migrant population in almost like the 100 districts and 9 states. And we are working with almost like 3 million migrant workers in the last 100 days. But basically, one major issue we identify as far as adolescent population is concerned, कि a large number of like the adolescents are also migrating. For example, if you take a example of Bundelkhand to Delhi corridor, and basically thousand like the adolescents migrating with their families, sometimes alone, from Bundelkhand to Delhi for the construction work, for the some other kind of like the services or work. And in this difficult time, they also face a huge problem. If you see the one story in the NDTV, one adolescent boy, he traveled from like Bundelkhand to Delhi for work, and he was struggling to for the transportation, and he want to go back his home village in the Panna district of Madhya Pradesh, but he was not able to like connect. So these kind of issues are there. So sometimes like the civil society or philanthropy or like the government focus on the issues, and the issue that media already highlighted very well. But in last 100 days, like the media or some other like the even in the social media, issues related to the adolescents not highlighted very well. One another thing about the shelter homes. So basically a large population of the adolescents in the shelter home, and basically during the lockdown period, we identify many cases in the shelter home, cases related to sexual exploitation or physical abuse. But these like the adolescents are not able to report these cases into the police. Same thing in the quarantine center. If you see the one case in Haryana where a one like the adolescent girl rape, actually the gang rape, and she struggled a lot for the filing the complaint. So I think like the adolescent population is not in the priority of most of the institution or like the stakeholders. But the same time, their need is very high. So we basically try to develop some kind of a program. So In two districts of Madhya Pradesh, we initiated a one process where basically we try to develop a joint program of social sector organization like the NGOs or like the community-based organization. Same time, we also try to mobilize some of the communities, and then the government stakeholders, particularly like the Women and Child Development Department or district legal aid authorities. So these kind of interventions are very important, and we try our best, but still lots of struggle are there for fundraising, for like the mobilization of the government authorities or policy makers. I can give you two, three example about the most excluded community, because when we discuss about the situation of the entire community in the COVID situation, but if we can prioritize the most excluded community, for example, Manuel Esquenja community, the community engage in caste-based commercial sexual exploitation, because if you see the states, some North Indian state like Madhya Pradesh, Rajasthan, and Uttar Pradesh, about 100,000 adolescent girls are engaged in the caste-based commercial sexual exploitation or quote unquote like the prostitution. These girls like face a tremendous amount of problem or challenges during this period, and basically the trafficking, sex trafficking is also increased. The sexual exploitation of these like girls is also increased. So that's some example like the Manuel Stranger or the caste-based commercial sexual exploitation cases. But if you see the cases related to sexual abuse, so because Shirin ji is also here, and she worked very intensively on the violence against women in last like 3 months. But many times like the domestic violence related cases highlighted very well. But when we discuss about the cases related to adolescent population, like cases particularly related to rape or like the gang rape or sexual abuse of adolescents, not highlighted, because these population are not able to go and report the cases. So that's a very important point about the mobility. Okay, they are not able to reach out to the police. They are not able to reach out to the any like the helpline. So the mobility and the connectivity is a one huge issue. But the same time, we have like multiple stakeholders in our criminal justice system, including like the police, medical institution, judiciary, or mental health institution. So this population is also not able to like go and file the complaint or like express their voice or share their like the cases of violence or abuse. So that kind of issues are also there. So I think that we realize as an organization the connectivity is a very important, and actually we as in civil society we were not invested well for solutions. So if we can work on the technology part, so if like we can connect these population through the technology, we were not focused well on the research part or like the data collection. So for example, we in last like 3 months, we collected lots of data of the migrant workers. So basically currently we have a data of 1.5 million migrant workers in 5 states of India. But when we initiated a process to collect the data of the adolescent population, we faced lots of problems, because the civil society organization are not enabled to collect that kind of data, because this issue is not in the priority. So I will stop now. I will take another 30 seconds only. Like my like the request is ki if we are working with the most excluded community, for example, like survivor of rape or sexual violence, manual stranger, the victim of trafficking or commercial sexual exploitation. But within that, if we can prioritize the adolescent population, and within that group, if we can focus more on this population, because they are not able to like raise their voice, they are not able to connect with the service providers, so then it would be very helpful. And the second issue is the vulnerability of the adolescent in all these social groups. I'm not saying in general like the adolescent population, but within the social excluded groups, the vulnerability of the adolescent population is very high. So I think a very immediate response or urgent attention is required in the current situation. Now I can stop. Thank you.
Yeah, thanks, Asif. I think you've given a well-rounded understanding of so many vulnerabilities and so much urgent. And sometimes I find it sad to call it vulnerabilities, right? They are human right violations actually that is happening. But I think we are facing so much and we're hearing so much every day and constantly. And I'll come back to you, Asif. because I would like for us to also think about, I think, a lot of participants, since there's so many NGOs and civil society participants on this group, I think a lot of what Asif said will resonate with you. It would be good for us to also then spend time today to think about what has worked, what has helped. So when we talk about the fact that we need for them to not be invisible, that there needs to be that mobility allowed, that we need to ensure that they are looked at all the way from children in institutions to marginalized communities who are at homes but not safe. Let's think about let's think about how we can actually work towards, or at least hear from this conversation, some, I can't say we'll have answers, these are very complex issues, but some methods or ways that we are looking at trying to resolve it. So I'll come back to you, Asif, but thanks for setting this conversation up. And if I can go to Anand now, from Anand Sinha, from David and Lucille Packard Foundation. Anand, if I may, if I can nudge you to talk about, what is it that you were faced with when COVID started, in terms of what did you hear back, the top three things from your grantee partners and not-for-profits? And then how do you think, and this is less about just the foundation, which is the Packard Foundation, but you being connected with other grant makers, what do you think you've seen as certain good practices, if not best practices, in the way foundations, grant makers have responded in trying to prioritize the adolescent mission centric issues?
Okay, thanks. Um, so top three things that we've heard, and I think the audience here knows them better than I do, but just sort of top of mind, I think, is one is the issue of funding and fears and seeing the sort of diversion of funding happening. I think more than 50% of the people who answered the polls today have talked about the fact that they've seen either partial or significant movement of funding away from the adolescent health issues or the adolescent development issues that they work on. I think secondly was a concern of how are operations going to exist or happen in the current COVID scenario. I am a field organization. I typically the need to be able to be mobile, be out there, be connected with people and communities is going to be hampered. And what does that mean? I think the third thing is essentially sort of think the uncertainty of it all. How long is this going to last? What's going to be the short-term, midterm, long-term sort of implication of this? I think that's something that everyone is dealing with significantly. And maybe one of the other things is, how do I as an organization sort of adapt to the new work culture, work environment, funding culture, funding constraints? And some of it was to do with the fact that how do I become more technology savvy to be able to become an organization that can work and take advantage of well, not take advantage of, I think, survive in the current scenario. So that's sort of I think the first question about what have we heard and what are we hearing. I think the other thing was just a concern that are funders going to be responsive, flexible, and and sort of understanding of the fact that COVID significantly derails an NGO's ability, especially in implementing organizations' ability to sort of work as on as planned or on a normal schedule. So I think that's what we've heard from NGOs. I think what we're hearing from philanthropies and funders is there's a word that I'm hearing more of than ever before, which is pivot. So I think that's sort of like what we're hearing. Essentially, the view from where I sit is that there is a spectrum on which funders are spread right now. There is, I think, one end of it, which is that drop everything. COVID is the single biggest crisis that the world has had to deal with in maybe 100 years. and we need to do everything in our power to sort of to combat that, whether it's relief, food, support, medical treatment, strengthening health system, educating about COVID, or finding a vaccine and finding a cure, etc. for COVID, and sort of and looking at those things. I think that's sort of on the one spectrum, and that's also a spectrum where we're seeing the emergence of entirely new funds, and it's not just the sort of existing philanthropies or donors, etc. There are people who are just coming in and sort of saying, okay, here's 100 crores to find a cure, or to find a way of alleviating the situation. And I think there's the other end of the spectrum, which is sort of saying, it's important to stay on course, and assume and remember that the things that we have been working on, we work on because they matter and because they are issues for the world, and they haven't changed in the light of COVID. I think in the light of COVID, if anything, all of these things have become worse. And that I think applies even when we think about adolescent development. On a good day, adolescent development and adolescent issues were not an issue, were not something that people really cared about in the world in general. We have to do a lot of advocacy. We have to raise our voices to make people understand why adolescent issues are important. With COVID, raging in the background, that just becomes harder to sort of to be able to stand up and be heard around those issues. So the movement away from adolescent issues is obviously going to happen, because in the priority of sort of I think development issues, it's always been one that has struggled to stand up and be heard, and be sort of noted as a priority. I think one of the things that we are trying to sort of see, and I think the other thing we're seeing from donors is an approach where they're saying, how can we sort of, how do you make good use of a crisis? I mean, I don't know, the saying has been going around, but never let a crisis go to waste, right? So how do you how do you sort of see the opportunity out of that? And I think in the case of adolescent sort of development, we are seeing a number of opportunities, which whether it's related to saying things like, now that we are actually seeing what is the effect of lockdown, right? And what is the effect of young people being locked up in a place that we assumed was safe, right? Which is home. And now we're seeing the reality of what that's happening on a much larger scale than ever before. Maybe we'll begin to understand a little bit better as to what are some of the issues with adolescent development with respect to psychosocial support, with respect to sort of mental support, mental health that is needed even in the home environment. It's not something that happens somewhere else. I think that's coming alive and becoming, more and more present right now. I think there's a sea change that's happening in education right now, and a whole move towards sort of technology and work from home and study from home and online education and schooling. And the question is, how is that sort of filtering down lower into the socioeconomic, lower socioeconomic groups, harder to reach communities, people who don't have access to technology? How will we sort of rethink, education? And I guess there is the question again of saying, what is the opportunity in this crisis to try and address some of those questions? From a sort of sexual reproductive health point of view, I know that one of the things we've been thinking about is, again, how do you take services and products and methods closer to the consumer per se? And because we simply don't have the health system as that intermediary. Again, on a good day, we know that the health system was crumbling. In COVID, we know it's completely sort of in the ICU, as it were. And so how do you sort of, assume that without that system in place, how will we get health services there? I think these are sort of the creative opportunities and the creative, sort of ideas that funders are thinking of. And that's, I think for us, that's how we are trying to balance to a great extent. How do we stay on course and stay with the issues around, young people, women, sort of gender, reproductive health, but also be responsive to COVID without completely sort of abandoning that viewpoint. Most people, I think, do agree that at some point in the future, this COVID storm will subside, whether it is because we figure out the vaccine or whether because it just goes away, something happens, whether it's 6 months, whether it's a year, whether it's 2 years, it will subside. And when that subsides, the issues that we have focused on right now will remain, and what COVID is doing is making those issues exacerbated. It is just making them worse, and it is, making the need for working on those issues, frankly, greater than ever before. But there is a range of ways in which we can decide to respond to that opportunity.
Yeah. Thanks, Anand. But if I can just ask you one more follow-up question, in as we've also heard this, take advantage of what's happening right now. Um, we've heard a lot like take a pause, relook at strategy. However, I think the reality is NGOs don't have time to take pause at all right now. But if we talk about saying, okay, let's for 1 second, let's take this chance or this time which has been a shock to the system, to think and imagine new ways of doing things in a better way, in a transformative way, in a less incremental way. What have you seen, if you can just give a few examples, at a model level, at an innovation level, at a strategy level, that you feel you've seen a few organizations or groups do that has been attractive to the grantee community, to the grantor community, or to the funder community, to feel, I see, this is how you can continue to sustain focus on what were original missions. Is there anything you could share there?
It's actually kind of difficult. I mean, I think the one thing that sort of is rising to the top right now is probably just how we see and how we think of technology. From a funder's point of view, I think that there's been interest in, but there's also been skepticism about what is actually the transformative role of technology. And I don't think it's been seen as truly sort of transformative, but it has been innovative, and sort of it's exciting for that. I think the COVID sort of crisis is now opening the doors for, whether it is telehealth and telemedicine, or it is online education and looking at sort of distance learning and those kinds of things, in a completely new light, in a completely new need state, frankly. And therefore it's sort of heightening our readiness to at least open those doors for policymakers are willing to open the doors and have those discussions. And that means that there's a significant opportunity for funders and civil society to walk into that doors and innovate and demonstrate. So that's, I think, one example of something that could become truly transformative.
Thanks, Anand. And we'll come back to this huge debate and conversation about digital inclusion, exclusion, technology. We'll come back to it. But if I can now just take it forward with Anita. Anita, thanks so much for joining. What time is it where you are? We can't hear Anita.
Yeah, it's 10:19 p.m. I'm in California. It's not as bad as if I was in New York.
Oh, thanks for staying late.
Right outside. Don't let the picture confuse you. Completely fake background.
Yeah, that's the beauty of Zoom. But Anita, if I can move to you, and I know yesterday when we were speaking, we were talking about digital inclusion. There is some work that you're doing, but if I can just take a pause and focus on some of the vulnerability pieces, to continue to focus on the issue of violence, vulnerability, what Asif spoke about, but to take it to this area of measurement. See, we all know at the end of the day, if we talk about what's working, there has to be some kind of results metrics you show back. Even in uncertain times like COVID, we have a few foundations who are asking for daily to weekly reports almost of the kind of progress, even if at an activity level. But I think all of us are looking at saying, what are some of the measures that we can use at this point in working on the issue of equity, in working on the issue of gender, adolescent girls, adolescent boys, and how can we make it a more of a public good and less expensive, not just a technical expertise. So if I can just ask you to speak a little bit about the effort that you have been leading, and how the nonprofits here can start using not only what you are developing, but as a community, how we can get better at using some of these metrics and measurements.
Sure. So we have a project called the Emerge Project, and I don't know if somebody could pop up the screen for the Emerge Project. But while that's happening, I'll tell you a little bit about it. So Emerge was developed as a website platform so that you could identify measures that have been tested and validated. So we could basically say, these are measures, they're available for free, and you can just actually lift them off. And we're in the stage of actually making a next level website that we hope to have. We will have a new website up in the next month. And then within about 6 months of that, it will actually be such that when you go and you look at your measure, instead of cutting and pasting, you would actually just get to download the measure to make your surveys, and it lets you know where the measure came from, who's used it. And we think that there's a couple of reasons that are really important with regard to that. So number one is that it helps you know that you're using scientifically valid measures. And number two, it helps us start to use some of the same measures across areas. Certainly we understand that there could be adaptation for context, but when we have some similar measurement, and you can see this from the NFHS data, when we have similar measurement, we can draw comparisons by population or geography. So this was funded by the Bill and Melinda Gates Foundation, and when COVID started arising, we were asked to create a COVID page, and so I'll ask you to go to the COVID page. This, by the way, if you go to this website, we would love to have you. You can register. Everything on this is free. There's nothing on it that that requires payment, and all of the measures are there, and all of the science underlying how do you engage in good measures is there. And you can also email us if you have questions. There's a means of doing that. And if you register, we just send you updates on availability of measures. So we were asked, because right now, how do you have measures that have been tested in the field when there's an issue at hand that's never happened before? So we actually work to put measures together based on what's been in the field before and adapt it for use with COVID. So if you could scroll down just a little bit more. So you can see that these are the areas, and all of these, and we're continuing to bring more areas together, but these are the areas that we've developed measures for. And many of these we've kind of been discussing today. So you see digital connectivity, and included in that is cyber control and abuse. Domestic work distribution, we haven't talked a lot about that, but one of the things related to education that we've heard about is that the girls and women are having more domestic labor responsibilities with everyone being at home. And that can also mean that when people are at home, there's unequal opportunities that can form regarding digital access, for example. So how are you getting schoolwork done? It could be unequal distribution of time for schoolwork. So we try to do some assessments on that. With Women and Girls Agency, there are some of the things that we were learning about COVID was that, and some of this came from qualitative, we talked to people in the field, was that, with the presence of men at home more, restrictions on girls had increased. So things that they used to wear around the house all the time, suddenly people were noticing it and cared about it or commenting on it. So we tried to be as inclusive as possible with regard to family planning and reproductive coercion. This was a big question because we were hearing a lot of women don't want to be pregnant right now. This is a difficulty, but the access to contraception can be severely hampered in the current circumstances. So we tried to help people really be able to go into that. So I just recommend, if you go to the website, which you can see there at the top, you can just go ahead and get whatever access you need. And then we can also show you, I can show you, Shailaja thought that maybe the partner violence would be of interest, but before we go there, I noticed that a lot of people were focused on mental health. And, and also Anand mentioned, I can see you all registering, so thank you. Please, I encourage you to keep going and doing that. I can see your emails pop up. I want to highlight the mental health and the psychosocial issues that Anand had just mentioned, because I have to say that actually with regard to the research, and the research is now just starting to be published, this is probably the area that we are getting the most robust information about. We actually are in the process of having a paper that we're revising that shows that every day into the shutdown was related to an increased and greater severity of mental health symptoms in the form of depression or anxiety. So we know mental health is a problem with the shutdowns. We also know that social support actually alleviates that. At the same time, there's isolation. So some contexts have more social support and some don't. Those are really important measures right now. So mental health is one that you would see. There's another in there that's social support and community engagement. If you could take me to the partner violence. Well, you can go to that one if you, yeah, the partner violence. So I was, in terms of abuse and exploitation, I think it's really important that we recognize that in situations of crisis or disaster, you're going to have a series of periods, right? There's immediate need. So immediate need, and a lot of this were in our polls, like I put down that relief services are getting most of the money, and everyone can understand that, and particularly health-related relief services at my institution, which includes hospitalized care. So that's really important, but as poverty and isolation increase, we're going to see greater vulnerabilities. We already know that there's an increase in partner violence in home. That's been documented in a number of countries at this point, but we do think that we're likely to see earlier marriages of girls, which often happens, as a consequence of crisis and poverty, sexual exploitation. So this is very consistent with what Ashik was talking about. And we want to make sure we can capture that. So this actually is a series of questions. If you could just go down. This is conflict and violence in relationship. This is sexual exploitation. Next one. We recognize that for many people, the issue at hand is that they won't want to report what is happening in their own lives, or you may not feel comfortable. A lot of people are doing phone surveys now, or even if they're able to be in the field, they're needing to be outside in locations that there has to be enough distance from others, but with everyone distancing, there's not as much distance that you might be able to get that's completely isolated. So an issue is what we call bystander behavior. How much are you seeing this happen? Do you think it's increasing? And do you think it's increasing more in light of the pandemic? And the other thing is like, what did you do about it? Because we've known that there's historically been wonderful programs that have been moving people to intervene when they see it. We think a couple of things are happening right now. We think that number one, there's increases in violence. We think it's not just domestic violence, policing violence as well. We have some other questions elsewhere on that. But we believe violence is going up, and intervention, social intervention from our civil societies is likely decreasing because we're more and more separate from each other. So it's not just important for us to know what our programs are doing, but what the immediate needs are at this time. We recognize that data collection is really difficult. We know that phone surveys are very difficult right now and are yielding biased samples, but we think that it's really important that we have some information on which to build our programs, because the immediate needs and then the needs that are going to be there in the next 3 months and then the needs in the next 6 months are likely to change. Thank you.
Thanks, Anita. And, just for all the participants and the chat, we're noticing we're going to try and collate some of the comments and bring it back. I know there's a lot of conversation around technology. We are hoping to have a follow-up discussion. I'll come to that later. But just taking off from, and connecting the dots a little bit. Asif spoke about agency and the complete lack of agency at the crux of everything we're doing. And it seems, Anita, from what you're saying also, that's a foundational piece that we're seeing is really, it's, being eroded, if not eradicated completely at this point. And that only then, if to be specific, I think that's what's showing up as a need. We all talk about agency. We all talk about that as a foundational piece, but who really is supporting it? And let's be honest, which funders coming and saying, we would like to do agency building work. This is the grant amount for that. This is how to measure that. But yeah, that's a valid point, pulling it all together. I just wanted to move to Shireen Vakil now. Thanks, Anita, and I'll come back to you. So Shireen, just looping back to you now, you have been involved in working a lot with the government as well. The Tata Trust's balances not only being a grant maker, but you have implementation projects as well. And there is a fair amount of government engagement in taking the voice of civil society organizations and other foundations and funders together, especially the work around gender-based violence and the adolescent agenda. So with that, if I can just ask you, and to be a slightly more directive and specific, in what do you think has worked in terms of having the government listen to not only the COVID relief innovations or what we have to say as civil society, but also some of these historical or traditional issues of things around adolescent gender, domestic violence, and women?
The government. Your question was, can you hear me?
Yeah, you were frozen a little bit. Do you want me to repeat my question?
Can you hear?
Yeah.
Okay. I didn't get just the.
Yeah, Shireen, maybe the connection isn't great. If I can request you to just switch off your video, then it may be better. Yeah, thanks. So if I can, I hope you can hear me. And if I can repeat the question back to you is, we have seen an openness from the government at this point in hearing about, what civil society is doing in terms of COVID relief and having certain consultations. But I know you have been leading some of the efforts in prioritizing the issue and focusing on gender-based violence, the issue of women and girls, especially adolescents. Can you share what has worked in some of this advocacy? How have we looked at ensuring that the government focuses on this?
Yeah, so one of the things I think is that, the government currently now has recognized at some level the role of civil society and NGOs, and has, in terms of the COVID relief, through both a lot of media awareness as well as, themselves having, can you hear me? Can you hear me?
Yes.
Okay, because it said I can't unmute myself. And therefore, I think it gives a sort of opportunity to highlight some of these issues from us who had already, like groups who have already been maybe engaged with the government, but they have created a kind of empowered group through Niti Aayog to liaise with civil society. Niti Aayog themselves previously had a group that connected with civil society, but they want to strengthen that. And ministries as well, the Ministry of Health, etc., have recognized that there is, the civil society and NGOs play a large role. So obviously what they want is to make sure that things get delivered, that people get what they need, but it provides civil society an opportunity to highlight certain issues that they may not be looking at and that are much harder to highlight. So in that front, because, the migrants, as Ashif was saying, it was all over. I mean, nobody could ignore it. And that combined with media pressure, plus a lot of organizations coming together to work with the migrants, and then using that, for instance, right now, they're looking at ways that one can have more protection, better labor laws, better codes, etc. But in that, I think the whole issue of women and girls in general has been missing. And as you probably know, been working with groups, with groups who work with women, women's groups and other foundations, etc. And, who there are such huge issues, but they're missing. And nobody actually talks, even within migrants, the fact about women migrants, anyway, people tend to say he, that's the way. And the focus is on the man, like all of them are men. But women migrants themselves, and then more so younger women or girls or children, even boys, are quite ignored and out of the picture. And what are those specific issues, vulnerabilities that they face and they need to be addressed, because there are a host of issues. So what are those specific things, and where are we at huge danger of slipping back? So even an issue like child marriage that we had actually made, India had made quite a lot of progress on. We all know that with pandemics such as that, that's one of the things that can surge. And with people's incomes being hit, there is a huge risk. But what is being done and what should be done in the immediate term, in these next 3 months, 6 months, 12 months, it's very critical for a group of people, like the people on this call or others who are working with this group, to actually come together and think about what exactly needs to be done. It could be very specific measures, like, for instance, because of the pressure on migrants and food, you've seen that the government has now extended the free rations for the next 5 months. So such things that actually need to be focused on women and girls or adolescent girls need to be called out, whether it's to do with schools, whether it's to do with safety. And I think, Ashif Bhai made a point that he collected a lot of data, 1.5 million migrants, I think, but could not collect the same data on for adolescent girls and violence against women and girls. And because, for instance, I know that he works on this issue, and because I feel that it is such an important issue and needs to be given more attention, it's always in my mind. But for others, they probably would not even think of it. They would think that, okay, this is work on migrants. So where I was thinking, for someone, a group, an organization that, let's say, is working with different issues, how can you bring in and call out, like, within the migrants, the women migrants, the adolescents, what is the data that you can show? What are their specific vulnerabilities? So before we go to measures like you were talking with Anita, which of course are important, the actual basic data is not there. And how can, I would put you, Shailaja, Dasra, as working with the Adolescents Collaborative, how can we as a group of funders, civil society, etc., make sure that there is this data collated? Because the National Commission of Women, for instance, the Ministry of WCB has given big pushback. We're all saying there's increased violence. The minister has said there is no such increase in violence. And, for adolescents themselves, like overall, but what is that? And the groups on the ground have seen it. And even if they have collected for 200 people, 100 people, 1,000 people, if someone like Ashif has collected for 500,000, that's fantastic. But even any of that data is important. And I would, like to hear later from Anita what she feels about that how can one best do that? Because without that, it's hard to both design programs to get people to design programs and put their money there, but also to influence policy. So I think that piece, without making it too complicated, is really important to work on, and try and understand what are the reasons that you can't get people to think about adolescents or children, young adults, teenage children, because the issues are huge, whether it's lack of school, whether it's mental health and depression, not having food. I mean, we know that we have about 54% adolescent girls who are anemic anyway. So what's going to be the aftermath of this? So it should be possible, but we need to think of what are the reasons that it's not foremost in people's minds. And now with COVID, how could we build it in? So let's say, how could we make sure that it's not one thing against another, right? But to say that if you're looking at vulnerabilities and you want to improve situation, you will not do it if you do not focus on adolescence or take a strong gender lens into your work and you ignore these issues, then actually there is real danger in not being able to benefit these most vulnerable groups.
Yeah. Yeah, no, that makes sense, Shireen. Shireen, two questions as a bit of a follow-up to what you just mentioned. I think, again, being a NGO, whenever you apply for grants, and it exists even today, the key question is, do you work with government? Will you hand over? Is there an integration of, working with the government simultaneously so that you're not creating a parallel system? Have you seen anything at this point that has worked with organizations, and how they can, when district officials, state officials are so overwhelmed with the COVID situation, have you seen anything where, and how organizations or non-for-profits have been able to work with the government and do it in a successful manner?
Yes, several, and Ashif by himself he's there, I've let him speak for himself, as it were, and other organizations, definitely. And in fact, this is a time, if in fact, because they're overwhelmed, it's like, say, you and me, we have, 1,000 people to serve, and we don't know how to do it, but we have to do it. I mean, not 1,000, 100,000. And there's someone who comes and says, look, I know what to do. I work in these communities. I can reach these villages which are really isolated. And this is what is needed. And we can help you do that. So they actually are welcoming that. I feel that in a way, when I think Anand used that a sort of metaphor that how do you make the best of a crisis, where government was actually not open to civil society, absolutely not open to civil society. I'm not talking about foundations like big groups like the Tara Trust, but I'm talking about civil society groups on the ground. They are currently really keen. And now there's this new buzzword. The Prime Minister said, I can't remember, give vocal to local or something like this. So that again, you kind of can use that as a way to say, okay, you need to support this smaller community-based organizations, etc. And I think the question is not, when you're going to hand over, you can make that plan. But as I'm saying, even now, if you can show that, let's say, in the food issue or school issue, that you have this technology that can be used, or you're suggesting that sanitary napkins or IFA tablets, there is a low cost maybe supplier, or self-help groups can make it. It's your kind of technical inputs as well that you can give. In terms of taking over a program, I think that's not really how it works in a way. It's more working together to make sure the kind of thing you are doing, it gets part of the wider practice of the government, as well as helping in the sense that, let's say if schools have to open, when should they open? What are the protocols that should be followed? Have you gathered data of how many girls and boys of this age group are there? Are you doing door-to-door tracking to make sure they're coming into schools? That it's more that kind of thing, and how then you can work in actual partnership. I think that's the thing. And as I said, I think, for instance, Ashubhai is probably working with the district commissioners of labor, and they are, because of the data. And I think there again, because that data was gathered, and you could say actually in UP, Bundelkhand, Madhya Pradesh, this is the situation. I think that makes a big difference. And then using media, using other voices as well, and then kind of getting it into their programs or schemes.
Yeah, no, thanks, Shireen. And I think you mentioned, and let's come back to Asif. If I can come back to you, Asif. Like I said, you laid out some of the vulnerabilities and issues very well. But the other part that we want to focus on in this part of the discussion now is to really dive into recommendations. What we're going to also try and do from this is make this webinar slightly more action-oriented, collate recommendations from each stakeholder as much as possible. And so if I can ask you, Asif, if you were to list, let me do one by one. Ultimately, I want to ask you for top 2 recommendations on how organizations can fundraise for their mission that they want to pursue, because I know you have been no NGOs or anyway satisfied with the funds. We always have more work, but there has been a certain sense of leverage and progress you have achieved in fundraising. So if you could share 2 recommendations for how other organizations can learn, and then after that, if you can share 2 recommendations for how to work with the government, one by one, please.
Yeah, so first of all, it would be very difficult to go like this, because I always believe that fundraising is not a like the separate game or like the separate kind particular activity, because if we can influence the government like the decisions, or the government is interested, or government take this kind of issue in their priority, so then fundraising is easy. If the media will also give a priority on the same issue, then is easy. So I think all these issues are related. So I can make 4 or 5 points, and all these 4 or 5 points are like work together. So my first point is ki we need to establish a category like a social group category as an adolescent girl or adolescent in our system, because such category currently not exists in the government system. If you discuss with the women commission or like the Ministry of Women and Child, so their focus on like the 0 to 18, or sometime like the 0 to 14. So this such categories not exist at a center level or and the state level. So if we can do, and Shirin is very good for the advocacy or like the engagement with the government. So I think if we can establish this category in our government system, including like the Niti Aayog or the ministry, then we can easily like convince to the policymaker you can invest more and more financial support from the government side on this work. So that's the first point. The second point, as far as migrant worker is concerned, we are doing lots of advocacy work at the state level and the national level. And in last 1 week, like even last 5 days, 2 state government announced the commission for the migrant worker, because the media highlighted this issue very like positively, or like media provide all the information in bit and pieces about the issue, about the like the situation of the migrant. So now the governments are also very much open and interested to invest their financial resources or also give the priority. So basically 2 state government announced the commission. Central government also initiated one large program in 116 districts with the 50,000 crore rupees budget. So I think if we can do the similar kind of advocacy on the adolescent issue, so then we can ensure some kind of like the positive development from the government side. That's the second point. The third point is collaborative response is very important, because sometimes like the academic institution doing something, like the intermediary organizations are doing something, and then the grassroots organization doing completely different. So basically, if we can develop a comprehensive program where the intermediary organization, grassroots level activists or organization, and then the government system will work together and develop some kind of like the joint program. So that's a one another point. The third point about, because nowadays I realize like in this all webinars, the grassroots level organizations are not participating in these kind of discussion. And I'm not saying here like most of the grassroots organizations are there, but some organizations in the state of Uttar Pradesh or Bihar or Chhattisgarh or Jharkhand, the internet connectivity is not there, but they are doing very good work. So how we can connect that kind of organization in this whole process without internet connectivity or without English or without like the good like the language or other things. So their role is also very important. And nowadays, particularly for the migrant data connection, we realize the organizations are doing very good work, but because of the non-availability of internet or like the English or other things, they are not connected very well. So how we can include that kind of organization in this process, and organization like Dasra can facilitate process for the fundraising, and their need is very small. Like some organizations requirement is their budget is 90,000 rupees for a year. So they only require like very small amount of funding, but their work is very good. Their community based, their like cost is very like low. So that kind of one recommendation. And then the last 2 points basically about the data. Again and again, why I am highlighting the issue of the data, because in the government system, if we have a data and we can prove the problem, we can prove the solution through the data, then we can easily scale the solution. And government can also invest in that kind of like the things. But for the data, actually, if we can develop some kind of like innovative technology based solutions. So recently we have developed one mobile app called Jan Sathi app, particularly for the young people, like the young people, adolescent and the young people, and they can use the technology for collecting the data about the problem and challenges for their their friends and their communities. So that kind of thing is also very important. Sometimes like this tech solution required lots of one-time investment or initial funding support for the organization. And if we can facilitate that kind of process, that's very easy. And the last thing about the scale and agency. So basically scale is very important in this kind of work. And basically no any single organization can scale the one solution across India because of the different geography required, the different kind of solution. So I think if we can invest more and more in the innovative ideas, and we can provide support to the local organization to try and test the new idea. And last point is about the agency, because if you see the whole in this whole discussion, like the voice of the adolescent is not there, particularly in the COVID context or even before the COVID context. So if we can strengthen the agency of the adolescent, if they can participate in all these processes. I will give you the one example in UK. So 5 philanthropies came together in UK, like Comic Relief, Empower, and Star Foundation, and they initiated one award called With and For Girl Award. And I hope many people are aware about that kind of thing. So can we start similar kind of process in India, where the adolescent participate from the the ground level to the decision making level, and basically they investing in the groups of the adolescent population. So basically they are providing funds to the organization, and recently we are facilitating that kind of like the fund transfer or fundraising related thing for the 3 organizations. So I think that kind of innovative ideas are very powerful, and they invest very small amount of funding, like 15,000 to 50,000 US dollars in one organization. So through that kind of investment, they basically develop the agency of the adolescents. So these are the recommendations from my side. Yeah.
Thank you, Asif. And I see, yeah, Ranjana, I agree about the grassroots NGOs also. If I can just request the Dasra team, what we're going to do is share a link right now to a document where we would love to collate and get input from all the participants. We're at 108 right now. If we could ask you to don't distract yourself from this conversation, but later to please help fill in some of these recommendations. What we want to do is, like what Asif is saying, what we want to do is, we want as civil society, what should our voice be? Listening to everybody here on the panel, but from our collective experience and expertise, we have to recognize that there are a few challenges we're facing, but let's shift the narrative to saying there are a few recommendations that we have. What are those? How do we want to share that? So if I can ask the team to please put the link in the chat and ask the participants to then later, we will email you also, but look at that sheet and help populate that. We'll have some kind of a list of recommendations that we can pull up and collate. But thank you, Asif ji. Valid points for us to think about, especially the connectivity of organizations and therefore the populations who are not looped into even these type of dialogues. We completely recognize it. I just want to shift then to Anita. I know, Anita, you mentioned on the chat that you'd like to respond. So if you could please come in here, and then I will ask you also for certain recommendations. Anita, you're on mute.
Okay, can you hear me?
Yeah.
Sharina asked, if I remember correctly, you were asking like, what is it that's holding us back from focus on adolescence? And it made me reflect on, what created all of these efforts around adolescence in the US. And so most of us who are working in adolescence now, we do this work because our thought is these are very unique elements of what it means to be an adolescent. And this allows us to tailor what we do to that. So family planning is an obvious one, to just have the adolescents engage in a family planning program, and with adults, well, they're just not going to get it because you're not supposed to have sex, you're not supposed to know these things, you're sneaking out, you're not even supposed to date potentially. So, you know, I was thinking about it, and I was thinking this really came out of in the 50s and 60s in the US, a concern that I'm not sure was like that great a concern, but it was somehow some kind of political concern that adolescents were like, the bad behavior of adolescents is deteriorating societies. And it was a lot around things like sex and, you know, egging cars. And I think it did have a lot to do with the fact that kids had more freedom. They suddenly had cars and things like that. Now, I don't think that the work that's being done now is in that same vein. I do think it's really tied to the notion of like, this is a very developmentally appropriate approach, but we have the opportunity to do it because the infrastructures got made. And so when there's that political will to address something that's affecting the larger society, I think you get it. And then I think the United States and India are very similar in being democracies, and that political will is also for your voting populations, and adolescents don't vote. And so, I think that's really what holds it back. If you disliked adolescents more and thought that they were terrible for society, in India, perhaps you too would build up more money towards these efforts. But I don't think that's the way to go. And it's a really interesting thing because when I was thinking about it, I was like, well, that's the truth with family planning as well, right? It was all about like, oh, there's too many babies being born, and this is ruining society, especially, God forbid, poor people having babies, or different caste. In our country, it's color, and race. But then it changed. Like now it's about reproductive autonomy. We don't want to have population control. But oftentimes we're building on these infrastructures that were rooted in this other stuff. And so in a sense, the good of the position that you have in India right now, and that I love getting to work on in India, is there isn't this there's not an underlying demonization of adolescence that is part of the solution you're trying to build. Whereas there's a history of the notion of the problem behaviors of adolescence that is still something that is part of the way adolescent health is approached in this country. So the fact that you don't have to like make sure you're not doing that, I think it's really enjoyable to get to do this work in India. And I feel like it is not there's a lack of interest because the bulge of the adolescent population is so big. It feels like there's an absence of it's not inadequate interest, but inadequate resources. Mm-hmm. That's what it feels like to me. I mean, I would defer to you. I'm living on this beach right now, but in another country.
That's lovely.
But I don't know, and I know that Anand has been working with adolescents, and you have been working with adolescents, and I don't know if that's how you feel, but as someone looking in to the country, that's what it feels like.
Mm-hmm. Okay.
Yeah, thanks. Thanks, Anita. And I'm going to come back to you for recommendations, but just Anand, if I can just shift to you for a second, please. You've heard this conversation right now from Asif, Anita, need for data, and I want to focus for a minute on that as well. Obviously, the key recommendation coming through is that we need to collect data that helps in advocating. What has been your experience generally in how data can be used, but also if you can share back 2 to 3 top recommendations that you will have, that you could have for foundations on how they can better, in a more flexible, in a more community-centric way, support nonprofits and therefore some of the causes around adolescence.
Okay, so I think on the issue of data, and maybe also I think covering sort of what might be a recommendation, is the fact that it's an extremely challenging situation. The perceptions and our understanding of the issues right now is so much based on news and on social media and on what we're reading. And because there is the inability to go out and do field visits, go out and do surveys, go out and do research, our sort of understanding of what is needed and what the picture on the ground is at times I really do worry about how we're sort of forming those pictures and images and getting an understanding of the need. And I think this is where we need to support our partners who have that, ability to be on the ground, who have, exactly as, Asif is sort of, I think, wonderfully laid out sort of this really clear picture of what is the, complexity of issues. To have that from, from our partners is an extremely important part of, I think, making the case and understanding sort of what is needed. So I do think that is actually one of the top priorities right now for us, is to get information. And it's not necessarily just going to be data, survey data, but I think having a comprehensive picture of what is needed, because the nuances in which this is playing out and the unexpected sort of pathways that this is leading to, even if we're thinking about young people and adolescents and girls, is still not, entirely clear as such. I think, the pathways that we will find ourselves sort of trying to address or figuring out how to solve is going to be a very different set of problems than we had imagined a month ago or 2 months ago from now. I think, the other thing is, I think I really can't think of what to say, in terms of advice to foundations. I think foundations have their own sort of, internal processes. They all have their own internal struggles right now. I think the important thing to understand for implementing organizations and NGO partners is that, foundations are really spread along this spectrum. And it's important, therefore, to try and figure out where different funders are as you're approaching them, because the readiness of those funders to respond to a certain type of an ask is very different, because I think foundations actually have got very, very different and divergent approaches and sort of, what they're looking to fund right now is very, very diverse and very different. And so taking a single approach is not going to work at all in this given situation. It never has, but I think now it's just even clearer. I think the other thing to sort of think about is that, as Shireen has, sort of, I think, flagged the fact that there is increasing space for civil society, for philanthropies, for NGO partners, and I think the general move in the world is decentralized decision making. Sort of, I think we're recognizing fairly quickly that the idea of sort of, central command is not going to work in the COVID situation, and it is about, moving from sort of, prime minister's 8 o'clock speeches to actually saying the RWA is now in charge of deciding your life. And I'm sorry, I'm taking that from a very open point of view, and I'm joking. But it is sort of saying, it is now about local communities, local groups who are actually, sort of taking charge. And again, I was thinking about this wonderful example of, the Jan Sathi that Asif mentioned, which is the idea of, how do you sort of look at the communities who you work with as becoming the eyes and ears that reflect the needs on the ground and are able to therefore shape those asks at a very local level is really important, at least for us as a philanthropy. And that's one of the key approaches that we're looking more and more at, is not about, sort of us defining what we think is a need. It's not even about NGO leaders saying this is the idea or this is the, the programmatic sort of outputs that they're chasing, but it's more and more about saying, do you have the resources and the infrastructure at the ground level that listens to people, listens to communities? Because now as the sort of, the locus of control moves closer, or there is a willingness of the locus of control to move closer to the communities themselves, do you have the abilities to listen, to reflect, and therefore to shape those into very specific asks and needs at the community level? Again, this has always been a global truth. Listen to communities, listen to grassroots, shape programs in that light. But I think COVID is just sort of hammering that back into our sort of psyche very, very clearly, more than ever before. The fact that we think that we can shape these sort of national programs to respond to this need, I think, is now being proven again and again and again as being a flawed approach.
Yeah, thanks so much, Anand. And coming to Shireen, and then lastly, Anita, your 2 recommendations from you. So Shireen, can you please share the top 1 or 2 recommendations for or from on behalf of but what do you advise? What do you think we should include in our list of recommendations back to civil societies and back to funders and back to government?
Yeah, I think that one of the things is that for organizations, as Anand and others may have mentioned, people don't really have an adolescent sector. So let's say in the Tara Trust, we don't have adolescents as a group. We don't even have children as a group, to be honest. So we have health, education, livelihoods, even migration, a whole host. We have 17 different themes. So I think it's important to look at, like I'll just give an example of our own work, that where is it that we can most fit this in our current context? So people have talked about menstrual hygiene management, for instance, or sanitary napkins as one of the issues. So how can we make sure, and adolescents would be very affected by this. So how can we try and maybe integrate this into it? And especially since violence is an issue that many do not work on and find it difficult to work on, how could we bring this conversation? Because when I saw someone in the chat saying that they're doing some menstrual hygiene awareness through phone conversations. So is there then that way for girls or women to be able to express any risks or anything that's happened to them? Because obviously it's all about your body. So one is whether it's education. A lot of organizations, especially CSR, focus on education. So within that, how are they, this group, what are the specific vulnerabilities to point out that there is a much higher risk of dropouts at this stage? Young girls are at more risk of dropout. With the whole digital issue, girls have much less access to mobile phones and technology than boys or men do. And to think about that, what actually can we do to make sure that girls have more access to technology while keeping in mind the safety aspects of it? So while we talk about digital, we know that internet connectivity is terrible. Girls and women do not have the same access. There are a huge host of issues. So what can we do? So I think those are the things. And then I think the last thing is, marrying that, what Anand said, the communities, the work on the ground, what can be done differently with panchayats and community members, but then taking it all the way from to block to district to state to national, because you have to kind of close that loop. But that's what I would suggest, that yes, at a government level and at a national level, we can look at some kind of adolescent policy that cross-cuts. But for funders and organizations, try and see how we can fit this in other areas. So whether it's migrants or whether it's education or health. Can you hear me?
Yeah, thanks. No, thanks, Shireen. That was good to hear. Okay. And Anita, if I can just look back to you, your recommendations, and by recommendations, I just want to also clarify, it's not recommendations to this group, what we can populate as possible ways you have seen working for NGOs in ensuring that they keep to the focus of the vulnerable communities. So if you could please share some of that also. And sorry, if I can go back on one thing, we heard, we just heard the need for data, right? And if you could just speak to the cost effectiveness of how we can democratize it a little bit.
I'm so sorry. Can you ask me the question one more time? I'm so sorry. It's 11 o'clock and I'm just not as I'm not as on it as I am. Can you just ask me once more? And I'll be fast.
No, that's fine. Let's just leave it at this. What would you say are two certain best practices or recommendations that you have seen that work for organizations as they traverse through this COVID time in keeping to the focus of adolescents and vulnerabilities of young people?
Okay, so I don't know that I can speak to the best practices, but I would say that there are things you're going to hear a lot of people caution you against that we just haven't found to be the case. So number one, I've got a project active in Pune district right now in the rural area. So as you all know, that was one of the major hotspots. very early on in the pandemic when it hit India. And so that was where there was a shutdown. Now it has reopened. And one of our big fears was we were going to go back and nobody was going to talk to us. We have more than 90% retention. And there's two reasons I think for that. Number one is that it's follow-up, so it's a bit easy. And two, I think people are bored out of their minds. I think that we actually were getting people faster. So I think that as long as you're able to, if you're able to be, if you're a known entity and you have rapport, I don't think it's going to be difficult to get the data collection. And we do ask a lot of sensitive questions. We feel really comfortable with data based on the data that we have on COVID transmission, use of masks, and having the data collection outside in an outdoor space. We feel very good about that. So I really want to encourage people to just recognize I will definitely let you know about the Pune project, but not now. So two things, like one, there's opportunities if you can get back out in the field. We think that it can be done. The second thing is that a lot of people are like, oh, if we do it by phone, we'll get a biased group, or people won't disclose certain kinds of information, or we can't ascertain privacy. There are some ways to do that. So there's a protocol on our line, and there's always ways you can ask specific questions. So I want to encourage people to really think about the data they want to collect. But the second thing is that, and I mean this with the utmost respect, Indian data collection is just huge. It can be like 2 hours with a participant. And one thing I hope happens, because I've been on enough projects at this point that unless I'm at the helm of the project and try to get the survey down where they're an hour max, it's just a battle because everyone wants to put everything in. I actually think one very good thing that's going to happen from this entire fiasco of a health crisis we have is that we're going to have to learn to make shorter surveys, and we're going to have to think through what we want. So I think it's really important to hone in on what it is you want to be able to get from people right now. If you don't have clarity on that from the start, and if you don't have consensus, like if you're just trying to pull it together with everybody getting to include stuff, you're burdening people who are already burdened. And I highly recommend you ask sensitive questions in there, because let me tell you, there is a mental health crisis happening. And we were staggered by the suicide percents of reporting suicidality when we did our work when we analyzed the data from adolescents in Bihar. So I just really want to encourage people to get out there, not be afraid to ask the sensitive questions, but really be thoughtful about their methodology to stay safe. And really help use that as an opportunity, because people are disclosing because they're bored and they want to be able to talk to people about what's hard in their lives. So be ready to have the services that you can link to. And also, one last thing, we're finding women and girls are advancing in leadership, which we did not expect, but this is, for some reason, maybe because it's a health issue, women and girls are being given certain kinds of space to make decisions in ways that they weren't historically. So just be ready to ask the right questions and hone in and have your resources ready to be able to support your population.
Yeah, thank you, Anita. I know we're having a lot of people drop off slowly. I think an hour and a half is, thank you for your participation and focus so far. I think let me look at putting a pause to this. As we always say, this is not a one-time conversation. These conversations cannot happen with just a few of us. The idea is to just highlight and bring to the table a few voices, a few perspectives. We've done a few webinars in the past where adolescent girls themselves, teachers, parents have spoken. This time it was from a few degrees of separation maybe. And the idea is to kind of, bridge some of these conversations while keeping our young boys and girls at the center. And we're going to look at having them come on much more. I know a priority for us as one of the next ones, as soon as we can pull it together, is on the digital inclusivity or exclusivity that exists. We all recognize that it is not a universally accessed technology or pathway currently. However, there are innovations. There's a need to reimagine. And so I just wanted to tell this group, we'll be in touch for some of the next discussions where we want to hear from young people on what has worked for them in terms of leveraging technology or digital platforms, what hasn't worked, when do they see that they can access it, which of their friends or communities cannot. And we'll keep that in mind as a topic also. Okay, so thank you very much to all the panelists for being here, some very late at night. So thanks Anita, Shireen, Anand, and Asif. Asif, it was great to hear from you on what's happening in the communities and for laying it out, and also for the work that you do. Let's not waste any more time. I know it's a Thursday afternoon and we have to get on with it. But thank you so much for the participants. You all keep coming back again and again, a live chat. Please keep the conversation going. Please share some of the work and communities, because if I can say there's one thing we have heard continually in a non-debatable manner is we all have to work together in this. So that's what I leave you with, and have a good day. And thank you and bye-bye.